Hi, I'm Harris Harrington, creator of Depersonalization Recovery Total Integration Method, a 10-hour program that shows you how to completely recover from depersonalization disorder. Today, I want to talk about marijuana use and depersonalization disorder and how they relate. Okay, so I've gotten a lot of questions about marijuana and depersonalization, particularly marijuana-induced depersonalization disorder. So it's very common that people acquire depersonalization disorder by smoking marijuana. Sometimes it's the first time they smoke marijuana they get depersonalization disorder. Sometimes they smoke marijuana for a number of months and they finally get depersonalization disorder. It happens a lot of different ways. A lot of people are asking if marijuana-induced depersonalization disorder is different from regular or non-marijuana-induced depersonalization disorder, and whether or not marijuana itself causes depersonalization disorder. And so I've got all these questions, and I want to really answer them in this video. Let's start with first question. Does marijuana alone cause depersonalization disorder? The answer is no. Marijuana use does not, in and of itself, cause depersonalization disorder. So I personally acquired depersonalization disorder by smoking marijuana. So I smoked marijuana a number of months, and I was smoking a lot of marijuana and a number of times for a number of months, and I finally acquired DP through a panic attack. Now I was getting a lot of panicky highs preceding the panic attack that finally induced depersonalization. And when I got depersonalization, it was a really stressful period. I was worried about a lot of things. I didn't really have a direction in my life I was going, and so there was extra stress, and I had a panic attack, and from then on I had the disorder, pretty much, okay? And I experienced a lot of panic attacks later, and it started with the marijuana use. So the question is, does marijuana itself alone cause depersonalization? No. Okay, DP is sparked by a trigger. Now, marijuana is an example of a trigger. A DP trigger is a stressor that interacts with a predisposition. Okay, so there's two things you got to keep in mind. The trigger of DP and the underlying predisposition, the underlying causes that get sparked and that leave you vulnerable to developing depersonalization if you smoke marijuana. Okay, now triggers can be stressful circumstances, really of any kind, hallucinogenic drugs, marijuana. You could be studying for a test. You could just have a really stressful period and have a panic attack and develop DP. Or DP can develop gradually over time. It can develop on and off. It's the same disorder, and marijuana alone doesn't cause it, okay? Now, the reason why some people get DP when they smoke marijuana and others don't is because of these underlying causes. Okay, so let's talk about the underlying causes of depersonalization. A predisposition for developing DP is caused by a disorganized attachment style, growing up in a dysfunctional family system, chronic emotional abuse, neglect, social isolation, witnessing traumatic events, and interpersonal trauma, or any combination of what I've just described. Okay, these are risk factors that leave people susceptible and vulnerable to developing DP if they experience a trigger later on or any stressful circumstance. Okay, marijuana can be that stressful circumstance that triggers the disorder, but the trigger is just the tip of an iceberg of depersonalization, okay? Like an iceberg, only a small percentage of it sticks above water and is noticeable. So most people think depersonalization is caused by marijuana if that's how they got it. And a lot of times they try to undo what the marijuana did by taking a bunch of medications or supplements or trying to find another drug that undoes the That undoes the marijuana, right? So that's just a wrong way to think. You've got to look at the underlying causes I talked about, particularly emotional abuse coming from a dysfunctional family, interpersonal trauma, stress that's accumulated over time in your life and gets sparked by something, and you dissociate as a way of splitting off from the psychic pain to stay away from it, okay? So, not everyone who smokes marijuana depersonalizes because they don't have these risk factors. They don't have the predisposition. All right. Now, when people that do get DP through marijuana smoke that joint or take that bong hit or whatever, they have a panic attack. They oftentimes think they're going insane. They experience the fear of going insane, phreноphobia, and fear that they're losing control, and they experience the bizarre sensations of being detached from their self and cut off from the outside world. And then it becomes chronic. So how does someone solve marijuana-induced depersonalization? Well, to answer that, we have to ask another question. Is marijuana-induced depersonalization different from non-marijuana-induced depersonalization? The answer is no. They're the same disorder, fundamentally. Okay? So, no matter how you got depersonalization disorder, no matter what triggered it or how it onset, it is the same fundamental disorder. Now, everybody who acquires depersonalization has their own unique DP profile, unique set of characteristics that goes along with the disorder. Okay? Some people may experience more symptoms of derealization, some people experience more depersonalization, and just a lot of different associated comorbid disorders. Okay? Fundamentally, it's the same disorder, and it needs to be treated the same as anybody else who's got DP. Okay, so you've got to look at the fundamental issues. So it's incorrect to think that because you drug yourself into it, you have to drug yourself out. That's not going to work. Medications and supplements are very ineffective at treating depersonalization, let alone curing it. There's no cure known for depersonalization through that way. So if you want to experience a complete recovery from depersonalization, you got it from smoking marijuana, you have to process your emotional pain. You have to resolve your trauma from your childhood and from your adolescence, and you've got to process that pain and integrate it into who you are. Identify the parts of yourself that are unprocessed and process those, and basically develop a level of emotional resilience that basically rid yourself of the cause. When you eliminate the cause of the disorder, it goes away. Okay? So that's how you recover from depersonalization, and I talk about that in my 10-hour program extensively, and I give you a number of exercises on how to get over depersonalization, whether you got it from marijuana or any other cause.